Let's discuss tonsillitis. This means inflammation of the tonsils. And where are the tonsils located? Right here at the sides of the throat, okay? Now the tonsils reach their maximum size at the age of about 2. Why so? Because a child is learning to walk, meeting new people, and the tonsils, which are immune system, which belong to the immune system, they get larger. So because the child is talking, laughing, eating your shoes, so the tonsils get larger to trap the bacteria. So by the time the end of the teenage years has been reached, nature decides that the tonsils can now regress. So by the end of the teenage years, the tonsils have shrunk to just small patches, small glands at the sides of the mouth here. Okay. So by the time you reach the age of 20 to 25, the tonsils are minimal in size. But then some people can have tonsillitis. Now, what is tonsillitis? Tonsillitis causes fever, sore throat, bad breath, difficulty or painful swallowing, dehydration, swollen, painful neck lymph nodes here, just to the side, mouth breathing, snoring, or sleep apnea. You see, tonsillitis causes the tonsils to enlarge and cause all this. The continuous infection causes tiredness, lethargy, and malaise, meaning a feeling of unease all the time. White patches on the tonsils, pus draining from the tonsils, redness in the tonsils, tonsil stones present as white elevations on the tonsils. That's where infected material collect in the little crypts in the tonsils. There can be severe throat pain. There can be drooling because you can't swallow your saliva, so you drool. There may be difficulty opening the mouth. The size of the tonsil may cause a muffled voice. One tonsil may be larger than the other. Okay. Now, when all this happens, what do? We just don't dive in and take the tonsils out. There are certain criteria which must be met. Now, what are those criteria? In children, 7 attacks requiring antibiotics per year, or 5 attacks per year for 2 consecutive years, or 3 attacks per year for 3 consecutive years are all indications that we must take the tonsil out now. Okay. In adults, those who are 18 and above, the general recommendation is take the tonsils out if there are 3 attacks requiring antibiotics or more for 6 months. Okay, every 6 months, 3 attacks in a period of 6 months, or 4 attacks or more in a period of 12 months. All of these require antibiotics, but we find that sometimes the tonsils don't shrink even if we put antibiotics, even if we take antibiotics. Of course, enlarged tonsillitis is treated with a variety of antibiotics. Sometimes pus can collect just behind the tonsils and push the tonsils out. In that case, a little nick is required to drain the tonsils, and of course, removal of the tonsils follow. Enlarged tonsils can also cause sleep apnea, OSA, obstructive sleep apnea. And when a person comes to us saying that he's been recommended tonsillectomy because of sleep apnea, what we do is usually send him for a sleep study, okay? Because we must record exactly how much oxygen he's lacking. A sleep study, AHI, will give you a number called an AHI, apnea hypopnea index. Now, if this number is 15 per hour or more, then we operate. Now, what is this number? It's actually the episodes of wakefulness in an hour that you have. You wake up 15 times per hour and then go back to sleep. Okay. Now, this can result in daytime sleepiness. It can result in mood disorders. That's because you can't sleep. You have mood disorders. High blood pressure can result in cardiac arrhythmias. The heart doesn't beat properly, misses beats and all that, okay? And you may feel so sleepy that you fall asleep when holding the phone or fall asleep when conversing. That is when we take out the tonsils. Now I hope you liked my presentation. Thank you very much. Bye-bye.